With great power comes great responsibility.
Compromise where you can. Where you can't, don't. Even if everyone is telling you that something wrong is something right, even if the whole world is telling you to move, it is your duty to plant yourself like a tree, look them in the eye and say no. You move.
Never step onto the battlefield of ideas unprepared. Before you enter the fray, you need a plan. And there's no better place to get one than right here on Tactics with host Caleb Colquitt. The Situation Room goes live now on News Radio 1440.
And good Thursday evening, everybody. Welcome to the program here on Tactics, where speech isn't violence, tolerance isn't love, and disagreement isn't hate. Welcome to the program. I know we've been having some technical issues. Hopefully third time's a charm here. This is the third time we've tried to get this broadcast started. Hopefully the internet is going to cooperate with us, because there is a lot to talk about, a lot of things that we have to discuss, as always, starting out with our Alabama coronavirus update. So we're going to go straight there, as we always do since the start of this thing since we've been able to keep track of it. So hopefully we can bring that up. This is from the Alabama Department of Public Health, as always. So you will see there that as of today, we have 517 cases confirmed within the borders of the Yellowhammer State. And you know what that means. We have passed that 500 count threshold, which moves us into the next tier with the United States. Now, the United States had a similarly bad day yesterday, and it actually surpassed the threshold of 1,000 deaths in this country due to the Wuhan flu, which means that, yes, Alabama moved up, and yes, we have acquired quite a bit more cases, but we stayed more or less on par with the rest of the country. It was not a day that was particularly bad, at least compared to the rest of America, based on the statistics that I saw from the other day. Now, it is important to note that we have had plus 131 new cases today, but that's actually slightly less than we had yesterday. You may remember yesterday we had 157 new cases, which means that we actually saw our new cases go down a little bit, not by much, which means they're more or less staying on pace with the trend that we saw yesterday. I'm not saying that this isn't something that we need to take seriously, or that it's not something that we need to really look into. I'm just saying that we actually have seen a few less new cases today than yesterday. And one thing that I want you to notice too is the total tested 4,082 cases. That's about a 13% rate of the people that we've tested having COVID-19. So what that means is it's a little higher than the 10% we were experiencing earlier. Again, I attribute this mostly to new tests coming back, not all of the new tests that we have administered in the past 24 hours were the ones that had a higher rate of people being infected. It's more than likely what happened is that we're having tests from a couple of days ago come back, and those are coming back positive at a higher rate than that 10% mark that we saw recently, but not so much that this is something wildly out of the norm, at least compared to some of the things that we've seen here recently. And you will also notice on that graphic that we do have one death. That death that we were talking about yesterday has been confirmed by the Alabama Department of Public Health, which means that, you know, the story that we were discussing the other day from North Alabama, the Jackson County Commission, or I don't know why I said North Alabama. Anyway, the one that we saw the other day from the Jackson County Commission, that has been confirmed. That was Alabama's first death due to the infection of the coronavirus. So, you know, a lot going on yesterday. We saw the overall rates of COVID-19 along with the death rate go up nationwide, and our statistics have been more or less in concert with that. We haven't seen one that's a big explosion. One thing that I do think to be optimistic about is the fact that since we had less new cases, today than we had yesterday, it's a decent sign that we're not turning into what we've saw, for example, in Italy and China, because what they had is they had a pretty straight up curve where every single day was an exponential increase from the day before. Not saying that we won't eventually get there, and not saying that this isn't something to take as seriously as those countries took it. I'm just saying there's a little room for optimism there. Now, I want you to take a look at the second graphic also from the Alabama Department of Public Health, which shows the testing facilities that are available. And you will notice that one improvement that we had over when we reviewed this 2 or 3 days ago is that we were talking about there were a lot of bald spots, primarily in the southeastern and the northwestern portion of the state, and also, oddly enough, in Lee County, where there was a big blind spot with no testing facility, despite the fact it being one of the counties that had the highest rates of the coronavirus, and that has been rectified now. You'll see new facilities there in Troy, in Moulton, Alabama, which actually is a pretty good place to put one geographically. It's not the most populated place. However, one thing that you'll notice is it's not, Jasper, which is what I suggested, or maybe even Florence, which is another larger population, but geographically, Moulton's probably a much better place to put one anyway, because even though it doesn't have the population of the two towns that we just mentioned, it's more centrally located. And so that's actually a really good thing, especially when you're worried about people crossing state lines and crossing borders, that you have that. I actually see Chris is saying Lawrence County represent because there is that testing facility in Moulton. So the idea to put one in Moulton was actually a really good move. And then you'll see primarily there in the southeastern corner of our state, with Troy being covered, and then there are two facilities right next to the Auburn area there in Lee County. You have one actually in Auburn, you have another one in Valley. So really, I think the governor and the state government in general has done a pretty good job of placing these facilities, because you'll notice that there's an awful lot of them in the population centers, but they've spread them out in enough places. The only one that does give me a little pause is the fact that there's one nowhere near Dothan. And I think there really ought to be one in Dothan, because I'm glad there's one in Troy, but Troy's only about an hour from Montgomery, depending on how fast you're driving. And I was really surprised not to see one in Enterprise, because I felt like that would be a little bit more centrally located, sort of halfway between Troy and Dothan. But right now, Dothan, it does not have one, and I get that it's closer to the border and there's not as big a population in South Alabama, but I think that that would be one that would help. But really, we went from having 3 pretty big blind spots in the state to really only having one, and that one still has Troy, which is significantly closer than Montgomery was for that portion of the state. So overall, pretty good coverage from the testing facility placement by the state of Alabama. Now, we've seen the testing facilities, which again, that situation is getting significantly better. We've seen that we're seeing an increase in the number of confirmed cases. Now it's time to talk about the reaction to those cases and the people in that. So we had this tweet the other day from UAB, which I thought was very interesting and can tell us quite a bit about the level of preparedness Alabama has. So let's go ahead and look at this tweet by UAB, which talks about their patients. They say, as of 9 a.m., that would be 9 a.m. yesterday, I believe. As of 9 a.m., UAB has at least 60 confirmed inpatient COVID-19 cases, with growing numbers of patients under investigation. More than half those patients are on ventilators. This is further proof that the community action is still needed to stop the spread. Let's all do our part. #stay home. So a couple things. First of all, good advice, obviously. Everybody needs to stay home. Second of all, half of the patients that they have are on ventilators. If that is true, and that's going to be something that is at least somewhat reliable guide to how many people are going to need ventilators and special assistance with COVID-19, that gives us a good bit of insight into about what kind of facilities we're going to need to have and what we need to keep the number under for our hospitals throughout the state of Alabama to not get ridiculously overwhelmed. And I'm going to say this right out of the gate before we get any further into this. They're probably going to be overwhelmed anyway. Like, I know that this is something that a lot of people do not want to hear, But the idea that our hospitals, we can keep it to a rate, even if we do everything absolutely right, that they're not going to get overwhelmed, that's pretty much a pipe dream at this point. And I'm not saying that to scare people. I'm not saying it to cause a panic, because I actually am one of the more optimistic people on this. I'm just saying that the hospitals are going to be really overworked in this, even if we do everything right, even if we do flatten the curve. Now, there's a difference between it being really hard and being an absolute chaotic disaster, and I think that can be avoided. But I'm just saying that the hospitals are going to be pedal to the metal for at least a couple weeks, more than likely, if not longer, like we've seen in other parts of the world. So there was an article today by ABC 3340 Birmingham. Sorry, I have a hard time keeping the channels up, and I mean, we have the internet now, so who even cares what the numbers are? It's not like a lot of people are watching it on over the airwaves like they used to anyway, but the ABC affiliate in Birmingham, we'll put it this way, they came out with a really interesting article the other day on the number of ventilators that are available within the state of Alabama. So here is a statement by them. This is from their article. Alabama Hospital Association President Donald Williamson says there are more than 1,300 ventilators in hospitals now. About half of those are used by other patients. In other words, cases that are unconnected to the virus. Williamson says there are about 800 ventilators currently available for the COVID-19 surge. He'd like to see that number increase to 1,500. The state requested 200 ventilators from the Strategic National Stockpile. All right, so if we have about 800 available standing as of now, we don't have to do anything, we don't have to call in any favors, we don't have to buy more. That's a pretty good baseline for us to look at how bad this is going to be and how the projections are going to be for this virus in the coming days. And that being said, they have requested 200 ventilators. That does not mean that they're going to get them, but if the expert here that they have, Donald Williamson, who's the Alabama Hospital Association president, is to be believed, 800 is only about a fourth of what we really need to increase this thing to. Because he's wanting us to get from 800 to 1,500. That's almost a doubling. So with that being said, it's good that they've requested 200, and honestly, it may be a good idea, and I know that this is dumb, but this is how government works. Making a realistic request tends to do a better job in lowballing it a little bit, because you're more likely to have that request granted. It's hard to know whether that's a good idea or not in this situation, especially because it's so unprecedented. But in government work, sometimes it's better to make a smaller request and then make a smaller request later in hopes of getting them, instead of lumping it together into one giant request where they're going to look at that and be like, yeah, there's no way. So I know it's weird. I know it's somewhat a counterintuitive way of thinking, but when you're dealing with government, sometimes counterintuitive is actually the way to go. So looking at that, a 200 ventilators request is definitely going to help if we get that. You may remember, and we're going to talk a little bit more to this a little bit later in the program, hence the title, that this was Italy's big issue. Italy's big issue was not a shortage of doctors. Italy's big issue was they were limited on hospital space and capacity, because they were literally treating people in the halls and outside in giant inflatable bouncy hospitals. I'm not trying to make fun of it. It's just that's what it looks like, and that's the easiest way to describe it to somebody. It's a bouncy house that, instead of having a bouncy floor, it's just there on the ground, and it's a big bouncy hospital thing. I know it's weird, but it works better than having people just out in the streets being treated. And so that was Italy's biggest problem, is they didn't have the room in their facilities, and they didn't have the ventilators that they needed to be able to keep people alive. Because of this, and because they were so overwhelmed, they are now turning away anybody over 60. So if you have COVID-19 and you're over 60, you might as well just not even go to the hospital. And that's what Italy is really seeing right now. And it is tragic, it is sad, but that is the reality of what is happening in Italy. And that's one of the things that we're trying to avoid in America and in Alabama in particular. And so understanding that ventilators are going to be a very precious commodity and resource, and doing the best that we can to keep the level of sick people under that which it was in Italy, to where we overextend our healthcare system. Since that was Italy's biggest issue, that's what we're really focused on right now. Because if Italy had had this exact same number of people getting sick and needing medical care spread out over a long period of time, they probably would have been all right. Because they are a modern first world country and they have more or less the same medical technology as most other first world countries. Of course, there's always going to be some differences, but my point is, this isn't like Cuba or India or a place like that that's basically a third world country that doesn't have that kind of technology in most of their hospital facilities. Italy's a fairly modern European Western nation. And so because of that, this is a better comparison than how the virus would have hit some of the third world countries that haven't been talked about quite as much. So understanding that, that's why it's really important to know that following UAB's pattern, if their pattern of having about half of the people that wind up being hospitalized need ventilators, that would mean we can have no more than about 1,600 patients hospitalized at one point, because if we have 800 available for the coronavirus patients, then that means if we get over 1,600, we're probably going to have more people than that need ventilators. And that is a pretty small number compared to a state that has 4.8 million people. Maybe we hit that saturation rate, I don't know. Maybe we get the 200 extra ventilators from the national security stockpile. Maybe we just get an influx of ventilators, and because the nation is sort of working towards that, and Alabama is a little bit on the back end. I wouldn't say they were one of the worst states, but we're definitely not one of the better states either in terms of how sick we're getting and what rate we're getting infected with at this thing. So what we're really hoping is that states kind of get it staggeredly. So in other words, you're seeing really, really bad cases in Washington, California, New York, and to a lesser degree, Florida and Louisiana. What we're really hoping is that, and I'm not wishing ill on any of those places, don't misread me here, that they hit their peak and the part where they need that stuff the most before we do. Because if our neighbors hit that before we do, then when they're not needing ventilators and other medical supplies, and when they kind of cool off, they can send it to Alabama, and then when Alabama hits its peak and cools off, then it can send it to another state that needs it more if they get sick after we do. A state that's taking some time in getting infected with this thing, like New Mexico or the Mountain West. That would be ideal. We don't have a lot of control over that, and so that's more of just a thing that we kind of have to hope for. So then the question becomes, what happens if we run out? So Alabama Hospital Association President Don Williams, the guy that we just heard from in the ABC report, quote, "There is some technology that allows you to take a ventilator and help ventilate 4 people. Taking anesthesia machines that are usually used to mix anesthesia gases to keep people asleep, they can be used as ventilators." Okay, so this is really good news. It means that some of the things that we use as anesthesia machines, mostly for surgery, that kind of thing, they can be repurposed sort of on the fly as ventilators. And it is possible to use ventilators to help ventilate about 4 people at a time as opposed to just 1, which is typically what they do. We're probably going to hit the point where we have to look at stuff like that. We may have to have 4 patients crammed into a hospital room, all operating off of 1 ventilator, just because that's all we can do to keep them alive at that point. Now, if that does take place and we can repurpose this, that's a very, kind of a testament, to American ingenuity. But also, that's something that is going to really help us with these numbers, because if we can quadruple the number of patients that we can hold using those 800 ventilators, well, that helps us out quite a bit. That brings the total to about 2,400 as opposed to just 1,600. So that's going to go a really long way in helping us be able to hospitalize and provide care to the people that we need. It's certainly not ideal. I know it's not going to be able to help probably everybody, and the hospitals are still going to be really overwhelmed, but that is something that really helps us out there. Now, another thing that's going to help us out with this is that all across the nation, not in Alabama specifically, but just sort of in general in America, there are companies that are doing the best that they can to try to make the best out of a bad situation. For example, there was a report earlier that Ford and GM have drastically repurposed their manufacturing to ventilators as opposed to automobiles. Now, this is something that's really smart because it's not like a whole bunch of people are buying cars anyway, so it makes sense for car manufacturers to sort of repurpose their manufacturing abilities and put it into building things that we really need right now, like ventilators. So Ford is partnering currently with GE Healthcare to produce simplified versions of ventilators. So they're not as medically advanced as the ones that we probably have in hospitals right now. They're a simplified version of them, but the point is they'll get the job done. And it's really cool to see Ford doing this. They also are repurposing some of their F-150 parts to create face shields and respirators for healthcare workers for 3M. So they're partnering with 3M to help them do that. Now, to explain the difference in what you're hearing there, the ventilator is kind of similar to an iron lung. In fact, it may even just be an iron lung. I don't really, I'm not a doctor, so I don't understand. There may be a difference in those machines or not. But basically, that is the breathing machine that helps keep you alive when you're having trouble breathing. A respirator, and what's being talked about in the second half of this, where they're repurposing F-150 parts, those are the things that the healthcare workers themselves are wearing, the big mask that helps keeps them sterile and keeps them from getting sick and has the pump on the side of it to help filter out the air that they are breathing. That's what that is. So Ford is partnering on the one side with GE Healthcare to create the ventilators. On the other side, they're partnering with 3M to create the respirators to help keep our nurses and doctors safe from this thing while they're working with infected people. So it's just really, really good to see companies doing that. Also, Headley and Bennett, which I had never heard of before then because they're a fashion company, and I don't really know anything about fashion, as people that have watched my show for any length of time probably already know. But they are actually working right now. They stopped production on their clothing lines and started production on surgical masks. So that's really cool that they have repurposed what they're doing to create things that are badly needed for our healthcare workers as well. Now, there's a couple reasons why this is really good. Obviously, the more materials that we need, masks, respirators, ventilators, all that stuff, that's obviously good. I don't even have to explain why that is helpful in a time where we're expected to have big shortages. But the other side of that is that if we can create something akin to the wartime economy, that might really help us out on the economic side of things as well. Because you may recall that in World War II, it was when we made the shift from our normal economy to a wartime economy roughly a year and a half before Pearl Harbor happened and we actually went to war. When we made that shift, the massive boom in needing those facilities to produce things for us, that got people back to work and helped really jumpstart the economy. If we can do something similar here, where we just kind of keep the same factories and workers working, we just do it to different things and create different things than we would normally do, well, that can help keep the economy afloat much better than just putting it on pause and the government sending checks out to everybody. I'm not saying that that can't also have an effect, and I'll discuss that probably at a later date, but right now, looking at specifically what is being done with this, if we can sort of transition to that mentality of a wartime economy in like we did in World War II, where we were just manufacturing like crazy to try to support the war effort, and we look at this sort of like that, that may be something that goes a long way in helping us with that. The risk, of course, and the reason why that's different is in World War II, nobody was worried about cramming a whole bunch of factory workers into a very small space. That's obviously not a good idea with what we're dealing with now, but then the question becomes, is the cost benefit worth the risk of more people getting infected? And remember that the primary worry about this virus, it does have a higher lethality rate than the average flu. But the real concern here is not, and has never been, the lethality of the disease itself. What we're more worried about, and rightfully so, is the economic effect it would have if our healthcare system gets really overwhelmed like it does in Italy. Well, if we have more materials, then being overwhelmed is less likely. And so at least if people are going back to work and doing something like this, we're actually helping stave off shortages rather than contributing to them. That makes a big difference. And I'm not saying that it's a silver bullet or fixes all the problems, but you can much more justify people continuing to go to work to create things that are going to help with this crisis as opposed to that. And so let's go ahead and look. I wanted to sort of illustrate this with a clip of Mike Rowe talking about this. This is him doing an interview with Fox and Friends, and I think really articulating this point very well.
It shouldn't be a political thing, and I don't want to make it a political thing, but my answer to your question in general terms is this virus, we're going to see what capitalism is really all about. When we have these big conversations about the direction the country is headed and what direction the country ought to be headed, this is a chance, unlike anything I've ever seen, for corporate America to step up and do what the government simply can't do. Obviously, the government has a primary role in this, but I don't think they can do it alone. And I'm actually really heartened. 3M and Roush and General Motors and a lot of these smaller companies, too, who have completely retooled and retrofitted. I'm looking at these distilleries who are now making hand sanitizer. It's big and it's small. It's micro. It's macro. It's everybody doing what they can in a way that I think could ultimately make about the most compelling case for capitalism that we've seen in our lifetime. Now, having said that, too, Brian,
All right, and so that was sort of Mike Rowe's take on this, and I thought that he was absolutely spot on because the way that he articulated it, he said specifically, it's an opportunity, which is correct. If the companies themselves just kind of sit back and say, oh, that's the government's job, and they're the ones that are supposed to take care of us, well, the government does have a role to play here, and I know that that's shocking to some people, me as a libertarian saying that, look, the government's supposed to do really one thing, and that is to protect its people from threats, and this is obviously a national threat. And so I do think, even though I'm not giving a blank check or a license for the government to do whatever it wants, and I actually think that that's really dangerous, I understand that the government does have a legitimate role to play here. But at the same time, companies can opt in and do things that are really helpful to them. And one of the things that Mike Rowe didn't quite touch on, but is correct, is that the companies that do that are going to probably make quite a bit of profit. Like, they may not be in it for those reasons. They may be motivated just because they want to help, and that would be something that would be understandable. But even if they're motivated by profit, they're creating more of the things that Americans need in a time of crisis, which, of course, if prices go up and supply is low and demand is high, that's something that is going to economically benefit them. And so capitalism already has a built-in profit incentive for people helping other people in a time of crisis. I mean, this is something that is, I think, going to be incredibly helpful for them. And let's say that companies want to do this and don't even want to make a profit, like they just donate a lot of the materials that they make or something of that nature. Well, it'd be great if they did that. They don't necessarily have to, because I understand that that takes man hours and resources to be able to produce. But if they did that, I mean, can you imagine the good level of PR that's going to pay off for them in the future when the economy does get back up and running? And so there's a number of different ways that capitalism specifically rewards companies that want to help people out with something like this. And so, like Mike Rowe was saying, this may be a time where we see a case for capitalism being made that, I mean, would just be incredibly compelling. And you may also recall that when it came to South Korea, there were reports of South Korea that said that, yeah, one of the things that we did, and granted, there's a lot of other factors in South Korea that are not applicable to the United States, but one of the things that they did, and one of the reasons it wasn't as bad there as it was in Italy, is they got their private sector involved very, very early by their own admission. Basically, immediately, they started going to their private companies, private factories, and had them volunteer, really, to help do that and to help really combat this crisis. So that's the thing. A lot of these companies that are doing this now, the government isn't mandating that they do this. They're not taking over their factories and repurposing them. The companies are just saying, yeah, we want to do this. It gives our workers something to do. It keeps them employed. It keeps them working. And it gives us an incentive because we can make money off of this when we normally wouldn't be making any money at all. And so there's really a incentive on every side, a mutually beneficial relationship that is created, which is what capitalism is all about, to really help out with that. So to the larger point, and I wanted to do a side-by-side comparison, I was talking with some buddies earlier today. And one of the things that we brought up is that it's really not a great comparison to compare the United States as a whole to Italy or really any other European country, because the way that Europe is structured and the way that America is structured are completely different. It's still not a perfect comparison, but it is a more apt comparison, a more fair comparison to compare the states to individual countries in Europe. And so one of the things that that spurred on, and I thought it was a really fascinating discussion, is will Alabama become Italy? Because I think asking whether Alabama becomes Italy makes a lot more sense than will America become Italy. I'm not saying that there's not some fair comparisons and some things we could learn from that as well, but specifically, is Alabama going to become Italy? So there's two really big categories that I want to separate this out into. First off is on preparation. So on preparation is what we're going to look at first, and then we're going to look at just environmental factors, things that have nothing to do with the government, have nothing to do with the people of Italy or Alabama, just random environmental factors that happen to contribute to how bad it's going to be. But first of all, let's look at the things that actually are under people's control on preparation. So the first thing I wanted to bring up is this graphic, which shows critical care beds per capita based on country. Now, I could not find a similar comparative graphic for Alabama, but I'll explain how I can compare those here in a second. So you'll see that number one, and this is by Forbes and Statista, by the way, you'll see that number one, by a pretty big stretch, is the United States. United States has by far more critical care beds, which are really, really important when it comes to the COVID-19 epidemic. Those are the things that are most important because those are those critical care ICU beds that a lot of people are needing and are dying because they can't get in Italy. So at 34.7 per 100,000, United States is doing pretty well on that when compared to second place Germany and way down there in third place at less than a third of our rate. Well, roughly a third, not less than a third. Roughly a third of the number of critical care beds as America has is Italy. So that being said, we can compare that. We actually have above average hospital beds compared to the average state in the United States. So if you look at Alabama's regular hospital beds, not intensive care beds, but regular hospital bed capacity, we've got about 3.1 per 1,000. America's average is only 2.4. So we're significantly above average on number of hospital beds per 1,000 people when compared to the rest of the country. And so that's not a perfect gauge, but it's a pretty good gauge that our ICU and intensive care beds, that they're going to be comparably about the same level over average. In fact, we are tied with Missouri for 13th in the nation in ratio of hospital beds per 1,000 people. So this is one area that Alabama actually does really well in. And I know that in the state of Alabama, it's kind of a stereotypical thing. We expect to not be first in a lot of things or expect to not be really high in the rankings compared to other states in a lot of things. But this is one area where we're actually doing very, very well. And the fact that we have a larger hospital capacity than most is really good. Now, I saw an article in AL.com today that was sent to me by one of my friends that I was discussing this with, which pointed out that we don't have nearly enough hospital beds to combat with what this thing is projected to be. And that's correct. I'm not saying that that's wrong. Everywhere is going to be overpopulated in their hospitals with this thing if the projections come out to be accurate. But I'm saying Alabama's will be less so. There's a difference in saying that it's going to be better than it is in other places and saying that, oh, it's going to be no big deal. Well, I'm not saying it's not going to be a big deal. I'm not saying that our hospitals aren't going to be severely overworked. I'm saying that based on the data that I'm seeing, it's going to be better here than it is in a lot of other places, based on, if nothing else, just our capacity to care for people, our ventilators, our intensive care units. And another point that this AL.com article brought out is that our hospitals are very spread out because we have a rural population and it may take people a while to get to a hospital. Well, that's a very real concern. And that's something that is a big problem. But here's the thing. If you have to choose between driving an hour to get to a hospital or driving 5 minutes to get to a hospital that is overcrowded and turns you away, obviously you would pick the hour or two, even 2 hour drive to a hospital as long as they have space and capacity for you. So capacity is a much better gauge than whether or not you have to drive a while to get there. I'm not saying it's a non-factor, because there are people that can die on the way to a hospital, and we've seen that as a part of our a problem with our death rates in the state of Alabama in the past. So I'm not saying ignore it. I'm just saying that the more important gauge, which is overall capacity, Alabama actually does okay in. And a World Health Organization study of doctor shortages per 100,000 was conducted in, well, actually, it's sort of a conglomeration of different studies, but we're using 2016 because it was the most recent numbers that I could find for either nation. So Italy actually is very high compared to the rest of the world. They have four doctors per 1,000 people. The U.S., comparatively, has significantly less doctors. Even though we have a better healthcare system, even though we have better technology, which helps compensate for not having quite as many doctors, either way, we still have less than Italy, and we're sitting at about 2.6. Alabama is actually below average on that. Our average doctors per 1,000 people are 2.12. Now again, doctors are a less important scale, a less important gauge for how hard this is going to hit than overall hospital capacity, because that's been the number one issue. But it's still significant. And when you're looking at a rate that is almost half of what it is in Italy, that's not something to ignore or to take lightly. Like, this is going to be one area where Italy does a lot better than Alabama. And so this is one where they have a leg up on us, and that's just something to be aware of. Now, we've looked at the preparedness side of things. Let's real quick go through some of the environmental factors. Some of these are going to take a little less time to explain than others, but the average age in Italy is 45.4. The average age in Alabama is 38.9, so we're significantly younger on average than Italy is. This is a really big deal when you consider that the lethality rate, but also the hospitalization rate of this particular infection is much higher the older you get. So not only are we going to have less people die, we're also going to have less people that need hospitalization in the first place. That's something that really helps us out in comparison to Italy. They have a very old population compared to the rest of the world. Now, Alabama is older than average when you look at us compared to other states, but we're not nearly as bad as Italy, at least on this one very critical statistic. Also, the smoking rate in Italy is slightly higher. They have 23.7% of their population that are smokers, 21.1% in Alabama. So it's basically a wash. And you also have to keep in mind that coronavirus can be a bigger problem for you, even if you're a previous smoker, that you don't smoke anymore, but you used to. And that's not factored in to this statistic, which means that Alabama probably has a higher rate of former smokers, which are also at high risk. Not as much as a current smoker, but still at risk compared to somebody that doesn't smoke at all. And so on this one, really neither Italy nor Alabama is a winner here. They're pretty comparable in comparison to level of people that smoke. Italy has 533 people per square mile. Alabama has only 94. So if you're looking at how densely populated we are, Alabama wins that one by a country mile. We have less than 1/5 their population per square mile, almost a sixth. And so when you consider that, we have way less people per square mile, and that's really important for two reasons. First of all, it means our population is going to get infected less slowly. This is especially true if we social distance, which is why staying home is so incredibly important, and staying away from big gatherings, making sure that you're doing everything you can to prevent the spread of this thing washing your hands, not touching your face, so on and so forth, the things that we've heard 1,000 times. That's why it is so critical, because this thing really won't be a big advantage for us if we don't adhere to some of those things. But if we're looking at our density of population compared to Italy, Italy's a very densely populated nation. Alabama's very sparsely populated, and that can be a massive advantage for us if we take advantage of it and follow the rules that we're supposed to. The second reason this is a really important factor is it also means that our supply lines are going to be significantly less congested. So if you have people spread out over a larger area, then that means that when supplies do come, and I'm talking more about medical supplies in this particular sense, but this is true in general for densely populated versus sparsely populated areas. When you have to spread that over a larger area and there are less people to deliver to, your supply lines don't get nearly as gunked up. They don't get nearly as congested, and there's not nearly as heavy traffic on your supply lines or infrastructure as when there's a crisis in a very densely populated area. If you don't believe me, look at Manhattan right now. I mean, Manhattan is super densely populated, and you're seeing that in a real time, how that can be a real problem for your supply lines, because if you're like Manhattan, which is an island and super densely populated, it's really hard to get supplies in when you only have, 6, 8 bridges to the whole city? That becomes a really big problem. Now, Italy isn't an island, obviously, and the whole country isn't nearly as densely populated as Manhattan, so 533 is still pretty dense for a country. But the point is, theirs is so much more densely compacted than ours that supply lines are actually a lot better off here. Now, there's another factor that I want to bring up that you might not have thought of this one, but actually, oddly enough, a line from MASH made me think of this. So there is an episode in season 9 of MASH where Hawkeye and BJ are trying to create an artificial kidney machine, and they're talking about the ability to create one basically out of spare parts that they have around because they can't get a real one. And Hawkeye suggests that they just make one out of parts using things like sausage skins, the way that the original inventor of the artificial kidney, Dr. Koloff, I think is the way to pronounce his name, actually did. So BJ says, "Are you crazy? When Dr. Koloff invented it, he was at a university. He had facilities, he had funding, he had a research team." And then Hawkeye counters with, "Yeah, but we have something that he didn't have. We have Dr. Koloff to copy from." That's a big deal. And when it comes to all of this, one of the reasons I don't think that we're going to become Italy is by virtue not of anything that we've actually done, but because we have Italy to look at. We can look at Italy, we can look at China, we can look at North Korea, and to a degree we can even look at our fellow states and look at what they did that worked, look at what they did that didn't, and learn some things from that. Now, we have a very short window of time to do that, so it's not like, the analogy that I gave where Hawkeye could look at the finished product. But the point is, having experience of other people and other countries that have dealt with this is going to be vastly instrumental in handling this problem. Another thing, and these two are minor things for a couple of reasons. First of all, the first one, it actually has to do with our culture. Now, Italians are a very touchy-feely, very open society and culture, in the sense that, when a man greets another man in Italy, especially if they're family or if there's a level of affection there, they're going to hold their arms out wide, go touch them on the shoulders, and then give a kiss on each cheek. I mean, that's just how Italy is. And there's nothing wrong or right about that. It would make me severely uncomfortable because I don't do so well with human contact in certain situations, especially from other dudes. But the point is, Alabama's just not that way, and I'm an example of that. I mean, in Alabama, you have guys that are brothers or best friends, and they see one another, and they're just like, "Hey." I mean, that's all you're going to get. And that's something that actually does work in our favor in this, that the virus is far more likely to spread if you have a culture that is more touchy-feely. Hopefully, the fact that we are not that way, it's a minor factor, but it does play a role. To a lesser extent of like the dense population, but it plays some role is my point. And another one that may really help us out, it may be a really big factor, but we just don't know yet, is our climate. If the initial studies that we have seen so far turn out to be true, that high degrees of heat and humidity kill this thing, then Alabama could more or less be at their peak right now, and then this whole thing dies out by the end of the week. Now, that's unlikely, but, maybe. And I'm not saying that we should count on that, but it is at least a possibility, which is the reason that I wanted to suggest it. And that's one reason we may not be like Italy, through virtue not of our own preparedness, nothing that we've done, but because our climate winds up killing this thing out pretty quickly. So all in all, and I do have to go and to cut this episode short, I won't be able to do a chaplain's report because I'm actually going to go do a virtual Bible study with some of my friends and brothers over at Dalreda. But ultimately, my point in all this, I don't want you to hear this and say, oh, Caleb says it's not going to be that bad. We're not going to be nearly as bad as Italy, and we should, this whole thing's overblown and we should just go back to life as normal. No, that's not what I'm saying. In fact, most of what I have said is dependent upon people doing the things that we're supposed to do, social distancing, quarantining ourselves at home. That's the way that we're actually going to not become Italy. But ultimately, what I do want you to hear from this is that, yeah, it's going to be bad. It's not going to be all sunshine and rainbows. Even if the absolute best case scenario happens, it's still going to be pretty bad. But because of some of the factors that I've listed here, I just don't see us being nearly as bad as Italy. Maybe I'm wrong. I hope I'm not. This is one of those occasions where I'm actually predicting a better outcome than a lot of people are, which is surprising to me. Normally, I'm the doom and gloom guy, but right now, I actually do see a lot of reasons to be optimistic. And I think that as bad as this thing is going to be, we're not going to get to near the level that Italy is, at least not any time in the near future, and especially if we adhere to some of the things that we can do and do voluntarily without the government having to step in and tell us to do certain things. And so, pray about this, do the best that you can to adhere to these rules, and hopefully we'll be able to avoid the kind of almost post-apocalyptic scenario that Italy is going through right now. So just keep that in mind and do the best that you can to stay safe and stay healthy. And also, stay the course, friends. Tactics is a production of News Radio 1440 and Cumulus Media Montgomery. Opinions expressed on this program are those of the host and do not necessarily reflect the opinions of Cumulus Media or our business partners. Graphics by Jessica Dawson. Video production by Jackson Dean. Broadcast studio provided by Faulkner University. Location studio provided by the Dalreda Church of Christ. Copyright 20.